Good day, everyone. I am Daisyl and I'm going to discuss the characteristic, life cycle, disease or diagnosis, symptoms and treatment, prevention and control of Giardia lamblia. Giardia lamblia is a flagellated parasitic microorganism that colonizes and reproduces in the small intestine, causing a diarrheal condition known as giardiasis. Giardia lamblia is characterized with a teardrop of shape and measures 10 to 15 micrometer in length. There are two median bodies of unknown function, but their shape is important for differentiating between species. There are 4 pairs of flagella, 1 anterior pair, 2 posterior pair, and a caudal pair. These organisms have no mitochondria, endoplasmic reticulum, Golgi, or lysosomes. Giardia has a 2-stage life cycle consisting of trophozoite and cyst. Giardia parasites live in the intestine of people and animals. Before the microscopic parasites are passed in stool, they become encased within hard shells called cyst, which allows them to survive outside the intestine for months. Once inside a host, the cyst dissolve and the parasites are released. Infection occurs when accidentally swallow the parasite cyst. This all start and occur through consumption of unsafe water, eating contaminated food, or through person-to-person contact. Cysts are resistant forms and are responsible for transmission of giardiasis. Both cysts and trophozoites can be found in the feces. In the small intestine, incestation releases trophozoites. Each cyst produces 2 trophozoites. Trophozoites multiply by longitudinal binary fission, remaining in the lumen of the proximal small bowel, where they can be free or attached to the mucosa by a ventral saccing disc. Incestation occurs as the parasite transit toward the colon. The cyst is the stage found most commonly in non-diarrheal feces. Giardiasis is the disease caused by the parasite Giardia. To help diagnose Giardia infection or giardiasis, doctors are likely to test a sample of the stool. For accuracy, they may ask to submit several pooled samples collected over a period of days. The samples are then examined in a lab for the presence of parasites. Stool tests may also be used to monitor the effectiveness of any treatment received. Children and adults who have Giardia infection without symptoms usually don't need treatment unless they're likely to spread the parasites. Many people who do have problems often get better on their own in a few weeks. When signs and symptoms are severe or the infection persists, doctors usually treat Giardia infection with medications such as metronidazole. It is the most commonly used antibiotic for Giardia infection. Side effects may include nausea and a metallic taste in the mouth. Tenedazole. It works as well as metronidazole and has many of the same side effects, but it can be given in a single dose. Netazosanide. It comes in a liquid form and it is easier for children to swallow. Side effects may include nausea, gas, yellow eyes, and brightly colored yellow urine. There are no consistently recommended medications for Giardia infection in pregnancy because of the potential for harmful drug effects to the fetus. It is also strictly prohibited to drink alcohol while taking medication. There are also different factors may shape how effective a drug regimen will be, including medical history, nutritional status, and condition of the immune system. Therefore, it is important to discuss treatment options with a healthcare provider. To prevent and control the disease, we must practice a proper hygiene. Wash your hands. This is the simplest and best way to prevent most kinds of infection. Wash your hands with soap and water for at least 20 seconds after using the toilet or changing diapers and before eating or preparing food. Avoid contaminated water and food. Wash any raw fruits and vegetables with safe and not uncontaminated water. Peel the fruit before eating it. Avoid eating raw fruits or vegetables if traveling in countries where they may have contact with unsafe water. Also, prevent contact and contamination with feces during sex. Practice safer sex. If you engage in anal sex, use a condom every time. Avoid oral or anal sex unless you're fully protected. And lastly, clean up after ill pets and people.